The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, welcome to Health for a Lifetime. I'm Don McIntosh, your host today, and today we're privileged to have Dr. Neil Nedley from Ardmore, Oklahoma with us. Welcome, Dr. Nedley.
Thank you. Good to be with you.
Dr. Nedley is a specialist actually in internal medicine. He takes care of people every day in acute care settings, and he also is the author of a new book. And that book is entitled Proof Positive, an excellent resource material. Some of the things we're talking about today are going to be touched on in that book, but I understand that you also are working on a new book that will touch on our subject for today. I don't know when that will be out, but you're even in your busy schedule, you're able to do some writing.
We try to do as much as we can. That's why we can't predict when it will be out.
Our subject for today is something that is touching the lives of many people who are watching right now. The subject is depression. And in America, there are over 17 million people who have been diagnosed with depression. But worldwide, there's about 200 million that are suffering from this right now. So if you're watching today and you're feeling depressed, stay tuned. If you have a friend or relative or someone that you know that is depressed, maybe you would mention this program to them as well, because what we learned today I know will be helpful to you. It's been helpful to me just beginning to talk about this with our guests this morning. But Dr. Nedley, what exactly is depression? Maybe that's where we should begin. Maybe you can help us in understanding what we're talking about when we actually are talking about depression.
Depression actually is more than just a feeling of deep sadness. That's what most people really think depression is. That's one of the symptoms of depression, and actually one of the diagnostic indicators of depression. But really, strictly from a definition's sake, it is good to go over this. You cannot have recently faced obvious emotional trauma, but you still will experience at least 5 of the 9 symptoms for at least 2 weeks. So in other words, if you've had a death of a spouse, or if you have lost your job, or if something very traumatic has happened in your life and you're feeling sad, that is natural. We don't classify that as a major depression. But if you haven't had those things and you're still feeling deep sadness and at least 5 of the following 9 symptoms, then indeed you do have the definition of depression. And this is one disease that doesn't really require a physician per se to diagnose. Actually, you can almost self-diagnose if you know what the definition is. And then from there, it really requires a physician to try to find the underlying cause as well as the treatment.
So the people watching today that maybe say, hey, I feel very depressed, as they listen today, they can really have a good indication about whether or not they are truly clinically depressed, and then they need to get in touch with someone who can help them if that's what it seems to indicate.
Exactly. What are those 9 symptoms of which you need at least 5 of? One of them we've already mentioned, deep sadness. Apathy is yet another symptom. Agitation. Some people won't have the deep sadness, they'll have agitation. Sleep disturbances. Some people that are depressed will not be able to sleep at night, and others will sleep too much, and they'll be falling asleep through the daytime, and they'll at least usually have some sleep disturbance. Weight or appetite changes. Some people, when they are depressed, will eat more and gain weight. Others will eat less and lose weight. And that is one of the characteristic hallmarks as well. Lack of concentration is one of the 9 symptoms as well. Feelings of worthlessness is yet another. Morbid thoughts. Such as planning a suicide or contemplating suicide, or maybe contemplating self-harm or harm to others, would classify as morbid thoughts. and then fatigue. As an internal medicine physician, that's probably one of the most common symptoms I find in depressed patients is fatigue. In fact, when someone comes to me complaining of fatigue, I will then try to find out if they have any of these other 8 symptoms. And if they do have 5 of them, their actual cause of fatigue may be depression, and then we have to find out why in the world they're depressed.
Well, for the viewer watching today, what you're saying is if we have 2 to 4 of those for more than a 2-week period, we really need to be concerned about what's happening. Is that what you're saying?
Yes. Now, at the bottom of the last graphic, it did mention 2 to 4 is what we call subsyndromal depression.
Okay.
That doesn't classify as a major depression. Subsyndromal depression means that you may be on your way to a major depression, but even if you have 2 of those 9 symptoms, you need to take alert, and this program is still for you. But in order to be classified as major depression, you need 5 out of those 9.
It was interesting as we were talking before the beginning of the program that you said this is happening younger and younger to people that are 25 years old. Now there's a lot more people that have a major depression even by that age.
Yeah, we used to call this the midlife crisis. It used to occur more commonly in people in their 40s. But major episodes of depression in this country are now occurring at the age of 25 in many individuals, and a lot of individuals even younger than this. It is a disease that is on the increase in America, and we really need to start addressing this disease much more fully like we have addressed other important diseases in America, such as heart disease and cancer. And I don't think we've paid enough attention to this disease personally.
Is this the type of thing, you know, often you hear people that say, hey, well, I'm not feeling very good, I feel depressed. You hear people say, I just am depressed for some reason. And then you'll hear someone else talking with them and they'll say, hey, just, you know, pick yourself up, you know, grit your teeth, bear it, get through it, and you'll work through this. Is that good advice, or are there some risks that are involved in just following that type of attitude towards depression?
For someone who has depression, that is not good advice, simply because they cannot snap out of it. It takes, once we find out the underlying cause and then undergo treatment, it takes a week minimum before a depressed patient starts feeling better, and usually about 3 to 4 weeks until they get a maximum effect from whatever therapy we are instituting. And so if you're truly depressed, you're not going to be able to snap out of it. Now, some people might just be feeling sad for some reason or another. They didn't get enough sleep last night. They don't really have depression per se, and those individuals can snap out of it just by getting on going for a run for 45 minutes and getting good sleep tonight, and then tomorrow they'll feel great again. Now, that's not what we're talking about. People that have depression cannot snap out of it, and to give them the impression that they can is really setting them up for discouragement.
So what kind of things are they going to endanger themselves further? Are there any physical conditions, if they try and do that, that they may, you know, become involved in?
Well, I think it's important to understand that anyone that is depressed does have an increased risk of developing a number of problems, and this is why we need to address it early. It increases the risk of stroke by 50% in individuals that are depressed. There's an increased risk of sudden cardiac death in depressed patients, particularly those that have already suffered a heart attack. In fact, many heart attack patients have depression, and those individuals are at a marked increased risk of death. It increases the risk of heart disease in men. It increases the risk of death from cancer in both sexes. It increases the risk of death from pneumonia in both sexes, and of course it increases the risk of suicide. In addition, it does a number of other things as well, in increasing the risk of really a depressed immune system, increases the chance that your offspring will suffer depression and physical and medical problems. For years we have known that depressed patients tend to have offspring that have this tendency as well, but we haven't realized that depressed patients actually produce offspring that have more medical conditions, and so it can even affect the medical conditions of your offspring in an adverse manner. It increases the rate of decline in physical abilities with age. The reason why many people decline in physical ability is actually due to depression and not necessarily to another disease process. And then it does those things that we mentioned there on the screen in regards to impairing the immune system, and thus we see those complications of infection or cancer or other like diseases being more likely.
I believe that I heard recently in the news that they did study some people groups that, because they had very close family ties, they did have that depressive trait, so to speak. I don't know if that's the way to term that was passed on. And so if you're in a family that has history of depression, you really need to take this seriously.
You really need to take it seriously. And this is a disease that also can be prevented. Just like heart disease can be prevented, just like cancer can be prevented, depression also can be prevented. And if you know you have a family history of heart disease, like I do, I have a very strong family history of heart disease, I've taken measures to almost guarantee that I won't develop heart disease. You can also take similar measures to make sure you won't develop depression even though you come from a genetic background.
I think one of the things with depression, and having talked to people who are suffering clinical depression, and maybe some of our viewers today are thinking, you know, I feel almost depressed about being depressed. I feel like it's something I shouldn't talk about. Here I am, maybe they're a good Christian person, and they think maybe it's a sin to feel this way, or I have no reason to do this. Are these normal effects?
They're normal feelings when an individual is depressed. The feelings of worthlessness, feelings of guilt, and even being depressed come about. But that's where we really have to emphasize as far as finding the underlying cause of the depression. Some people are depressed simply because they haven't been following the will of God. And as a result of not following the will of God, they've had suppression to the circulation of their frontal lobe, and that in and of itself can bring about depression. I think one example in Scripture that I can think of was Elijah. Elijah running away from Jezebel, which he really wasn't supposed to do, he ended up in a pretty deep depression. And the Lord said, "What doest thou here?" And so that may be one indicator that if you are depressed, you may need to ask the question, what doest thou here? Have you been doing something in your life that is contrary to the will of God? And if so, can you change that around? But that's only one of many potential causes of depression, and that's why we need to really discuss those.
Are there any other things, Doctor, in your practice that you've seen that result? What are some of the other effects that you see as a result of depression?
Well, there are some other effects that we really need to discuss. First of all, there is an effect of osteoporosis can come about as a result of depression. Other factors, such as increasing the risk of return to addictive behavior, is very common. In fact, those that have been addicted to a substance, they often relapse because of depression. And so it's very important for those individuals to really recognize the fact that they need to prevent depression at all costs. And if they get into depression, they need to have it treated early, because it does definitely increase the risk that they're going to return back to that addictive behavior. It is one of the common causes of a chronic headache. And that's one of the things I go through with my headache patients, is that same list that we went through to make sure that depression is not the underlying cause. We mentioned osteoporosis. It's one of the causes of thinning of the bones. And when combined with stress, it increases the risk of HIV progressing to AIDS. Many people are unaware of the fact that even though you may contract HIV, you do not have to develop AIDS. There are many individuals out there that have had HIV for 15 years and have never developed AIDS. And really, it's boosting the immune system is the important aspect of things. And stress combined with depression is going to produce a big hit and dramatically increase the risk of a virus manifesting itself, such as HIV.
In that list, the one thing that kind of gripped my attention, I understand most of those, but talk a little bit about osteoporosis and depression. How is that an effect?
Well, as far as the mechanism of action, it's one of those unknowns at this point in time. There are some speculation as to how depression brings about osteoporosis on a hormonal basis, decreased absorption of calcium, etc., that can occur. But exactly how that occurs, it's unknown, but it is a well-established fact that thinning of the bones does result from depression.
You know, in many diseases that we hear about, I think since the time of William Castelli and being involved in the Framingham Heart Study, they began to look at heart disease, and they came up with this term risk factors, you know, that there are certain things that are definite identifiable risk factors. Is there something like that in terms of depression? Are we identifying things that lead to it?
Yes, we really need to do the same thing with depression, and that is, let's take a look at the risk factors for depression. One of the risk factors is the genetic tendency that we've talked about. Girls undergoing early puberty, it puts them at an increased risk of developing depression later on in life. Girls do not have to go through an early puberty if they're on a correct diet that is lower in fat and lower particularly in animal protein. And early puberty does have an association with depression later on in life. Out-of-phase circadian rhythm cycles. Those that are working at factories that change the time that they have to be at work every 6 weeks, and they have to go midnights and then afternoons, etc., they have an increased risk of developing depression. Or those that choose to get up at a different time every day or really get out of phase on the weekend, they increase their risk as well. Interestingly, grandparents who raise their grandchildren are at an increased risk of developing depression. And that is occurring in much more frequent occurrence today than ever before, with two parents that are working, and the fear of some of the things in daycare, etc. Grandparents are having to get involved in the raising of their grandchildren, and with the splitting of homes, etc. And so we're seeing grandparents come in with this disease at rather alarming rates. In addition, there is smoking is a risk factor not only for developing heart disease and cancer, but also depression. Interestingly, those that smoke have an increased risk of developing depression, and those that are depressed have an increased risk of picking up smoking. So it's one of those positive feedback cycles. And the same is true with alcohol. Those that drink alcohol increase their risk of depression. Those that are in adolescence who are not living with two biological parents are at an increased risk of developing depression.
So divorce.
That's right. Divorce and remarriage puts adolescents at risk. And then severe sexual abuse in childhood increases the risk of depression later on in life. The milder forms of sexual abuse have not been associated with this. It's the much more severe types of sexual abuse that have been.
So, of course, many of these risk factors, we can make choices to avoid smoking and alcohol. Some of the others were more or less victims. We can't, as children, say, well, you know, my parents are divorced and I was the cause of that. Although I think maybe that's one of the reasons they get depressed. They think maybe they are the cause of it. I don't know. But some of these things we can actually avoid.
Yeah, some are modifiable risk factors and other ones are not.
Well, in terms of risk factors, there's a difference between a risk factor and something that we know for sure is going to cause depression.
Yes.
Is that true?
That's correct. In fact, one of the things, you know, we have as physicians and even psychiatrists around this nation, I think for too long, have treated depression as the same disease throughout. In other words, I as an internal medicine physician label people with congestive heart failure. That's a diagnosis. But when I was in training, I was told very emphatically, don't ever just label someone with congestive heart failure. Find out the underlying cause of that congestive heart failure. Is it due to coronary artery disease? Is it due to valvular heart disease? Is it due to an atrial fibrillation and a rhythm problem, etc.? Because whatever the underlying cause is, if we treat that, then we can get rid of the congestive heart failure. And for years, we have lumped all depressed patients in together, given them a cookbook type of approach to treatment. And unfortunately, we are missing the causes. And if the causes are dealt with, then we won't have to be reliant upon all of the various medications that are out there to treat depression, all of which have side effects. So it's very important in my practice. And as an internal medicine physician, Don, maybe a lot of people will be surprised about this, but it is shown that about 1 out of every 3 people that I see in my practice in an outpatient setting that come to me with another disease process actually have an element of depression in their life. So this is something that I see about as commonly as any psychiatrist is going to see it, and that's why I thought it was imperative for me to learn as much about this process as possible. But in so doing, I have come to the conclusion that I should no longer label someone as depressed without attempting to find the underlying cause of the depression.
So really, that brings us back to the very word diagnosis. I've heard someone once describe it as dia, which means, to see through, and gnosis, to know, to really know and see through what's happening. And in acute care setting, I'm sure you see these people that have heart attacks and very traumatic things, and they're just set up for this type of thing. So what are some of the real, then, causes as you diagnose and you've seen people? What are the real causes of depression?
Well, one of the major causes of depression is actually a decrease in circulation to the frontal lobe of the brain. Actually, in just about every depressed patient, this is one of the things that we can almost lump every depressed patient into. There's a decrease in activity of what we call the prefrontal cortex by 40 to 50%.
Now, how can you tell whether or not there's a decreased activity? You can't tell that by looking at someone.
No, you can't. Actually, the only way of telling for sure is by getting what we call a PET scan. A PET scan is not an MRI, which gives us a picture of the brain, but it actually tells us about the activity. If we were to take our brain model here that's on our set here today, the frontal lobe of the brain is this portion right in here in the front portion, and the prefrontal cortex is actually above that. Or actually in front of that. And the prefrontal cortex is really what controls the rest of the frontal lobe. This is where our highest decision-making processes are centered. This is where the higher centers of morality and spirituality and the will are centered, is in the prefrontal cortex. And interestingly, when we do a PET scan, we can see not only what the brain looks like, but the activity, which portions of the brain are being metabolically active and are working. And across the board, just about in depressed patients, this area of the brain has a 50% reduction in circulation. So it is working in an impaired state in depressed patients.
So then, finding out about whether or not your frontal lobe is active, just in terms of without a PET scan, would be, again, back to the beginning of the program, we talked about having 5 of those symptoms of depression, and if you have 5 of those, you probably have a major depression. You probably have a depression of the frontal lobe. Would I be accurate in saying that?
That's correct. It's not really practical to get a multi-thousand-dollar PET scan on every patient to see if they've got depressed activity of the prefrontal cortex, particularly since just about every depressed patient is going to have that. And so what we do that's standard with all of our depressed patients is we put them on a regimen that is going to increase the circulation to the frontal lobe of the brain.
I know that we have more on that graphic that you showed us about causes of depression, but I think that maybe after we look at some of those causes and maybe some less common causes, we will want to come back to those symptoms so people can say, hey, I've been watching this program, maybe I just came into the program and I want to know whether or not I'm depressed, and we can show them those symptoms again, and then they can make a decision about where they are on that continuum. Well, let's go back to those causes you were showing us.
Okay. As far as other causes of depression, low brain serotonin levels. That's a chemical that is extensively used in the frontal lobe of the brain. If the brain is not making it appropriately, depression will come about. Insufficient dietary tryptophan. If there's not enough of the amino acid tryptophan in the diet, the serotonin cannot be synthesized. And that's one of the reasons for potentially a low serotonin level. And so we have to place patients on that program on a diet that is higher in tryptophan. One of the rather common causes of depression is a low omega-3 fatty acid intake. Omega-3 fats are different from the routine fats that most people consume every day, which are what we call the omega-6 fats. And omega-3 fats are present not only in fish, but in flaxseed, in green soy, in walnuts, And if individuals are not eating enough of these plant products of omega-3 fatty acids, they can actually develop depression just from a low omega-3 fatty acid intake. It's one of the actually necessary constituents of a good diet, is a diet high in omega-3. Low folate levels. Individuals that have low folate levels because they're not getting enough folate in their diet actually develop depression that is not treated with medications. It can be treated, but unfortunately the patients don't respond to it, and it's not until we get their folate levels up that they actually do respond to treatment. In addition, atherosclerosis, actually due to cholesterol plaques in the arteries supplying the brain, can cause many strokes to the prefrontal cortex and to emotional areas of the brain that actually bring about depression. So one of the same causes of heart disease can actually be a cause of depression, and this tends to occur as far as depression in the elderly is concerned. It's one of the reasons why heart disease patients particularly have an increased risk of developing depression, is because the same problem with the arteries in the heart is going on in the brain as well.
Dr. Nedley, what you've been sharing with us has been very helpful. If you've been listening today and you're wondering whether or not you are depressed, at the beginning of this program we had a list, a graphic that showed us the signs and symptoms of those that are suffering major depression. I want to show you that graphic in just a moment here. And Dr. Nedley, just remind us here by looking at this graphic, what are the signs and symptoms of someone that really does have depression, so people that are watching can know?
Well, they have to have 5 of the following 9 symptoms: deep sadness, apathy, agitation, sleep disturbance in some form or fashion, weight or appetite changes, either gaining weight or losing weight, lack of concentration, feelings of worthlessness, morbid thoughts such as thinking of suicide or injuring someone else or themselves, or fatigue. If anyone has 5 of those 9, they're suffering from major depression. We need to find the cause and then put them on appropriate treatment.
One of the things you've mentioned today in terms of treating depression is increasing the amount of blood that comes to that front part of our brain, the frontal lobe. And those of you who are watching today are probably saying, how do I do that? I want to have health for a lifetime. I don't want to be depressed. I want to point your attention as we close this program to this excellent resource, Proof Positive. And we hope that as a result of today's time, you will have health for a lifetime.